A patient with newly diagnosed diabetes is sitting in the waiting area. She appears sad and anxious. The nurse talks to the patient and tries to make the patient laugh. How does laughter help a person during difficult times? Select all that apply. 1. It increases the pain threshold. 2. It exercises the facial muscles. 3. It boosts immunity. 4. It reduces tension, stress, and anxiety. 5. It increases oxygenation in the body. Answer 1. It increases the pain threshold. 3. It boosts immunity. 4. It reduces tension, stress, and anxiety. Rationale: laughter has several therapeutic effects on a person's body, mind, and spirit. It increases the pain threshold and the body's immunity. It reduces tension, stress, and anxiety and improves the patient's mood. Exercising facial muscles through laughter does not help a depressed person. Laughter does not increase oxygenation in the body. While caring for a Muslim female patient, which religious beliefs and practices should the nurse keep in mind? Select all that apply. 1. They do not practice euthanasia. 2. Health and spirituality are two different issues. 3. Women prefer female healthcare providers. 4. During the month of Ramadan, they do not eat until sundown. 5. Medicines are not accepted because they believe that chemicals are harmful to the body. Answer 1. They do not practice euthanasia. 3. Women prefer female healthcare providers. 4. During the month of Ramadan, they do not eat until sundown. Rationale: Islam does not allow euthanasia or mercy killing. The women of this religion prefer female health care provider. Therefore, the nurse must arrange for female health care providers so that the patient is comfortable. Ramadan is a holy month for the followers of Islam. During Ramadan, the followers of Islam do not eat and drink until sundown. Therefore, the nurse must take additional care during this month. Muslims believe that health and spirituality are connected. Buddhists will reject some medications because they believe that chemical substances in the body are harmful. The nurse is caring for a 45-year-old female patient who has been scheduled to undergo a cholecystectomy. The patient insists on having a female surgeon. People of which religion are most likely to exhibit this behavior? Select all that apply. 1. Hinduism 2, Judaism 3, Buddhism 4, Islam 5, Sikhism. Answer 4. Islam 5. Sikhism. Rationale: female members of Islam and Sikhism generally insist on having a female health care provider. Members of other religions generally do not have any gender preferences based on their religious beliefs. The nurse understands that some people believe that there is no known ultimate reality. These people are referred to as agnostics. What are the beliefs of an agnostic person? Select all that apply. 1. They discover meaning in what they do or how they live. 2. They do not believe in the existence of God. 3. They do not find ultimate meaning for the way things are. 4. They believe that people bring meaning to what they do. 5. They search for meaning in life through their work and their relationships with others. Answer 1. They discover meaning in what they do or how they live. 3. They do not find ultimate meaning for the way things are. 4. They believe that people bring meaning to what they do. Rationale: agnostics believe that there is no ultimate reality. They tend to discover meaning in what they do and how they live. They are unable to find the ultimate meaning for the way things are. They believe that people bring meaning to what they do. An atheist does not believe in the existence of God and searches for the meaning of life through work and relationships with others. A senior nurse is talking with student nurses about spirituality. What are the different conceptual elements in spirituality? Select all that apply. 1. Transcendence 2, Faith and Hope 3, Inner strength and peace. 4. Meaning and purpose in life. 5. Connectedness. 6. Culture. Answer. 1. Transcendence. 2. Faith and hope. 3. Inner strength and peace. 4. Meaning and purpose in life. 5. Connectedness. Rationale. Spirituality has 5 constructs or conceptual elements. Transcendence is the belief that there is an external force beyond the material world. Faith refers to the firm belief despite any evidence of physical presence. Hope is a source that gives energy to move forward in life. Inner strength is a source of positive energy that drives a person in difficult times. Inner peace provides a calm, positive, and peaceful feeling. A spiritual person strives to find meaning and purpose in order to live a meaningful life. Connectedness refers to feeling connected with oneself, with others, and with an unseen force. Culture is not a part of spirituality. A student nurse is telling a faculty member that her patient talked about gaining spiritual comfort from being focused on her inner self, including her values and principles. The instructor explains that this is an example of A. Faith. B. Community. C. Interpersonal connection. D. Self-transcendence. Answer. D. Self-transcendence. Rationale. Self-transcendence is a sense of authentically connecting to one's inner self. Interpersonal connection is being connected with others and the environment. Faith is the ability of people to have firm beliefs despite lack of physical evidence and to believe in and establish transpersonal connections. With respect to spirituality, community is the shared faith between people and their support networks. You are caring for a hospitalized patient who is Muslim and has diabetes. Which of the following items do you need to remove from the meal tray when it is delivered to the patient? A. Small container of vanilla ice cream. B. A dozen red grapes. C. Bacon and eggs. D. Garden salad with ranch dressing. Answer. C. Bacon and eggs. Rationale. Islam prohibits the consumption of pork. A patient has just learned she has been diagnosed with a malignant brain tumor. She is alone. Her family will not be arriving from out of town for an hour. You have cared for her for only 2 hours but have a good relationship with her. What might be the most appropriate intervention for support of her spiritual well-being at this time? A. Make a referral to a professional spiritual care advisor. B. Sit down and talk with the patient, have her discuss her feelings and listen attentively. C. Move the patient's Bible from her bedside cabinet drawer to the top of the overbed table. D. Ask the patient if she would like to learn more about the implications of having this type of tumor. Answer. B. Sit down and talk with the patient, have her discuss her feelings and listen attentively. Rationale. Establishing presence contributes to a patient's sense of well-being. It helps to prevent emotional and environmental isolation. Automatically referring a spiritual care advisor might not be the patient's wish. She may not see an advisor as a resource. Reading a Bible can be an important ritual, but at this time, the patient needs to make a connection with someone who can help minimize loneliness and powerlessness. Providing instruction will be important, but the patient is not likely to be receptive at this time. A patient states that he does not believe in a higher power, but instead believes that people bring meaning to what they do. This patient most likely is an A. Academic. B. Atheist. C. Agnostic. D. Anarchist. Answer. C. Agnostic. Rationale. Agnostics believe there is no known ultimate reality. They discover meaning in what they do or how they live because they find no ultimate meaning for the way things are. They believe that people bring meaning to what they do. A nurse begins a night shift, assuming care for a critically ill patient who was resuscitated earlier in the day from cardiac arrest. He survived and is physically stable, alert-oriented, and responding appropriately to the nurse's questions. Knowing that the patient experienced a period when his heart stopped beating, what would be the best approach for the nurse to use with him? A. Have family come to visit and focus discussion about their gratitude that the patient survived. B. Change the subject when the patient begins talking about entering a dark tunnel when the doctors were resuscitating him. C. Sit and encourage the patient to share what he experienced during resuscitation. D. Provide the patient the opportunity to have passages from the Bible read to him. Answer C. Sit and encourage the patient to share what he experienced during resuscitation. Rationale: after the patient has had a near-death experience, the nurse promotes spiritual well-being by remaining open and giving him or her a chance to explore what happened and supporting him as he shares what happened. A nurse is caring for a patient with a seriously advanced infection who asks to have a spiritual care provider come who can offer blessing way, a practice that attempts to remove ill health. This patient is likely a member of which religion or culture? A. Hinduism. B. Navajo. C. Sikhism. D. Judaism. Answer B. Navajo. Rationale: Navajos use blessing way as a way to remove ill health by means of stories, songs, rituals, prayers, symbols, and sand paintings. Evaluation of spiritual care is necessary to determine if the patient's level of spiritual health has changed following intervention. If the use of rituals was part of a nurse's care plan. Which of the following questions is most appropriate to evaluate its efficacy? A. Do you feel the need to forgive your wife over your loss? B. What can I do to help you feel more at peace? C. Were prayer or meditation helpful to you? D. Should we plan on having your family try to visit you more often in the hospital? Answer C. Were prayer or meditation helpful to you? Rationale: rituals include participation in worship, prayer, sacraments, e.g., baptism, Holy Eucharist, fasting, singing, meditating, scripture reading, and making offerings or sacrifices. When you include the use of rituals in a patient's plan of care, evaluate if the patient perceived these activities as useful. If not, other interventions will be necessary. A patient who is recovering from a bilateral amputation of the legs below the knee shows transcendence when she states: A. My pain medicine helps me feel better. B. I know I'll get better if I just keep trying. C. I see God's grace and become relaxed when I watch the sun set at night. D. I have had a great life and a good marriage. My husband has been so helpful in my healing. Answer C. I see God's grace and become relaxed when I watch the sun set at night. Rationale: transcendence is the belief that a force outside of and greater than the person exists beyond the material world, in this case to help the patient cope with her loss and pain. The other options are more inner-focused and viable ways that help the patient cope. A nurse is caring for a 78-year-old patient with chronic multiple sclerosis. The patient has severe fatigue, muscle weakness, severe muscle spasms, and difficulties with coordination and balance. Her disease will likely worsen. The nurse has gained the patient's trust and wants to assess her life satisfaction. Which of the following questions should the nurse ask? Select all that apply. A. How often are you able to attend your synagogue? B. What about your family makes you proudest? C. What does your husband do for you at home? D. Looking back, what is your greatest accomplishment? E. How has your illness affected the way you live your life spiritually at? Answer B. What about your family makes you proudest? D. Looking back, what is your greatest accomplishment? Rationale: Spiritual well-being is tied to a person's satisfaction with life and what he or she has accomplished in work, personally, with family, and in relationships with others. Asking how often the patient attends synagogue assesses religious participation. Asking what the husband does for the patient at home assesses presence of community support. Asking how the illness has affected the patient's spiritual life at home assesses vocation. A 44-year-old male patient has just been told that his wife and child were killed in an auto accident while coming to visit him in the hospital. Which of the following statements are defining characteristics that support a nursing diagnosis of spiritual distress related to loss of family members? Select all that apply. A. I need to call my sister for support. B. I have nothing to live for now. Correct circuit. Why would my God do this to me? D. I need to pray for a miracle. E. I want to be more involved in my church. Answer. B. I have nothing to live for now. C. Why would my God do this to me? Rationale. Patients most likely to have a diagnosis of spiritual distress are facing loss or terminal or serious illness and have poor personal relationships, indicating that there is nothing to live for now and wondering why God would do this to him reflect dispiritedness, e.g. expressing lack of hope, meaning, or purpose in life, anger toward God. The other responses show a potential for enhancement of spiritual well-being. A nurse is preparing to teach an older adult who has chronic arthritis how to practice meditation. Which of the following strategies are appropriate? Select all that apply. A. Encourage family members to participate in the exercise. B. Have patient identify a quiet room in the home that has minimal interruption. C. Suggest use of a quiet fan running in the room. D. Explain that it is best to meditate about 5 minutes 4 times a day. E. Show the patient how to sit comfortably with the limitation of his arthritis and focus on a prayer. Answer. B. Have patient identify a quiet room in the home that has minimal interruption. C. Suggest use of a quiet fan running in the room. E. Show the patient how to sit comfortably with the limitation of his arthritis and focus on a prayer. Rationale. A quiet room with no distractions is conducive to meditation. The low buzz of a fan also blocks distractive noises. A patient should relax comfortably during meditation. Meditation is usually recommended 10 to 20 minutes twice a day. The activity should be conducted alone without distraction. A student nurse is developing a plan of care for a 74-year-old female patient who has spiritual distress over losing a spouse. As the nurse develops appropriate interventions, which characteristics of older adults should be considered? Select all that apply. A. Older adults do not routinely use complementary medicine to cope with illness. B. Older adults dislike discussing the afterlife and what might have happened to people who have passed on. Older adults achieve spiritual resilience through frequent expressions of gratitude. D. Have the patient determine if her husband left a legacy behind. D. Offer the patient her choice of rituals or participation in exercise. Answer. C. Older adults achieve spiritual resilience through frequent expressions of gratitude. D. Have the patient determine if her husband left a legacy behind. D. Offer the patient her choice of rituals or participation in exercise. Rationale. Older adult patients achieve spiritual resiliency in expressing gratitude and finding ways to maintain purpose in life. Leaving legacies maintains a connection between the person left behind and the lost loved one. Older adults frequently use complementary medicine, rituals, and exercise to cope with illness and pain. Belief in the afterlife grows with aging. The nurse is caring for a 50-year-old woman visiting the outpatient medicine clinic. The patient has had type 1 diabetes since age 13. She has numerous complications from her disease. including reduced vision, heart disease, and severe numbness and tingling of the extremities. Knowing that spirituality helps patients cope with their chronic illness. Which of the following principles should the nurse apply in practice? Select all that apply. A. Pay attention to the patient's spiritual identity throughout the course of her illness. B. Select interventions you know scientifically support spiritual well-being. C. Listen to the patient's story each visit to the clinic and offer a compassionate presence. D. When the patient questions the reason for her long-time suffering, try to provide answers. E. Consult with a spiritual care advisor and have the advisor recommend useful interventions. Answer A. Pay attention to the patient's spiritual identity throughout the course of her illness. C. Listen to the patient's story each visit to the clinic and offer a compassionate presence. Rationale: a person's spiritual well-being can change over time, therefore, it is important to pay attention to it over the course of his or her illness. Listening is a powerful way to support a patient's spirituality. Evidence-based interventions are preferred, but they must be agreed on by the patient and tailored to his or her perspectives and not just those of the nurse. Patients are not looking for answers. What is spoken as a spiritual question is most often an expression of spiritual pain. Using spiritual care advisors is a valuable resource but should be selected by the patient, not independently by the nurse, and any interventions should be mutually agreed on among nurse, patient, and advisor. Select the 3 factors that are evident when a healing relationship develops between nurse and patient. A. The nurse being able to realistically mobilize hope for the patient. B. The patient being able to share fears of loss with significant others. C. Finding an interpretation or understanding of the patient's illness that is acceptable to the patient. D. Understanding your own beliefs about spirituality. E. Helping the patient use spiritual resources that he or she chooses. Answer A. The nurse being able to realistically mobilize hope for the patient. C. Finding an interpretation or understanding of the patient's illness that is acceptable to the patient. E. Helping the patient use spiritual resources that he or she chooses. Rationale: according to Benner, 1984, 3 factors are evident when a healing relationship develops between nurse and patient. Realistically mobilizing hope for the nurse and patient, finding an interpretation or understanding of the illness, pain, anxiety, or other stressful emotion that is acceptable to the patient, and helping him or her use social, emotional, and spiritual resources. It is important that the patient be able to share fears of loss with significant others or express spiritual needs, and that the nurse helps the patient choose spiritual resources. But these are not reflective of the nurse-patient relationship. A patient has non-Hodgkin's lymphoma and is in the terminal stage. The patient is spiritually depressed and not ready to face death. What restorative care options can the nurse use to care for this patient? Select all that apply. 1. Prayer. 2. Diet therapy. 3. Supporting grief work. 4. Meditation. 5. Guided imagery. Answer: 1. Prayer. 3. Supporting grief work. 4. Meditation. 5. Guided imagery. Rationale: spiritual care is important for a person with terminal illness. Prayer reinforces one's belief in God or a higher being and is one of the most effective coping resources. It provides the patient with inner strength and a sense of peace and serenity. A patient with terminal illness needs time and the nurse's support to grieve, and the nurse should support the patient in a spiritual and therapeutic manner. Meditation and guided imagery reduce stress, pain, and blood pressure and provide increased spirituality. Diet therapy is not an option for restorative care. An elderly patient complains of severe pain in both lower extremities. The patient becomes tearful when describing the pain and states that it is intolerable. How should the nurse develop a healing relationship with the patient? Select all that apply. 1. By inquiring how the pain is affecting the patient's daily routine. 2. By telling the patient about various pain-relieving interventions. 3. By encouraging the patient to be strong and deal with the pain positively. 4. By asking the family to help the patient cope with pain and anxiety. 5. By administering pain medications and encouraging the patient to exercise. Answer 1. By inquiring how the pain is affecting the patient's daily routine. 2. By telling the patient about various pain-relieving interventions. 4. By asking the family to help the patient cope with pain and anxiety. Rationale: to establish a healing relationship and a helping role. The nurse should not just look at the patient's leg pain as a medical problem. The nurse should also try to understand how it affects the patient's daily life and spirituality, and work to improve the patient's overall well-being. By informing the patient about various methods to alleviate pain, the nurse mobilizes hope in the patient. The nurse should also help the patient use social resources, such as friends and family, who can help the patient deal with his or her health condition. Asking the patient to be strong and deal with the pain may decrease spirituality and increase stress and anxiety. The nurse should focus on more than just prescribing medications and exercise to develop a healing relationship. A patient who is hospitalized with heart failure states that she sees her illness as an opportunity and a challenge. Despite her illness, she is still able to see that life is worth living. Of what is this an example? 1. Religion. 2. Self-report health. 3. Hope. 4. Peace. Answer 3. Hope. Rationale: hope refers to an energizing source that is oriented toward future goals and outcomes. Faith allows people to have firm beliefs despite the lack of physical evidence. In this situation, the patient is energized by the future and has hope that it will be positive despite her heart failure. When caring for a patient who is suffering from a serious illness, the nurse encourages the patient to follow his spiritual practices. How does spirituality help in healing? Select all that apply. 1. It decreases the risk of infection in the patient. 2. It helps to treat without any medication. 3. It increases the pain threshold of the patient. 4. It decreases stress and increases the immune response. 5. It reduces perception of pain and anxiety. Answer 3. It increases the pain threshold of the patient. 4. It decreases stress and increases the immune response. 5. It reduces perception of pain and anxiety. Rationale: nurses who support the spirituality of their patients realize that the patient's spirituality enables them to heal faster because such thinking increases the pain threshold. It decreases stress, increases the immune response, and reduces perception of pain and anxiety. Spirituality does not decrease the infection nor treat without medication. Treatment of infection is through administration of medications to kill the microorganisms. What are the positive effects of spirituality on an individual? Select all that apply. 1. It affects health behaviors. 2. It affects quality of life. 3. It affects compliance. 4. It affects education. 5. It affects lifestyle. Answer 1. It affects health behaviors. 2. It affects quality of life. 5. It affects lifestyle. Rationale: spirituality affects an individual's health behaviors, quality of life, and lifestyle in a positive way. Spirituality helps individuals maintain health, well-being, and cope with illness. Compliance and education are not entirely dependent on the spirituality of an individual. A patient experiencing a stomachache was diagnosed with stomach cancer. The patient became anxious after the diagnosis. What nursing interventions would be helpful for this patient? Select all that apply. 1. Promote measures to reduce anxiety. 2. Encourage the use of effective coping skills. 3. Assess the potential for committing suicide. 4. Assess the potential for psychosis. 5. Encourage the patient to listen to music. Answer 1. Promote measures to reduce anxiety. 2. Encourage the use of effective coping skills. 5. Encourage the patient to listen to music. Rationale. The nurse should promote measures to reduce anxiety because anxiety further deteriorates health. Encouraging coping skills boosts emotional support for the patient. Listening to music decreases anxiety and helps the patient to relax. Suicidal tendencies should be evaluated only if the patient shows signs of depression. Psychosis is usually due to a neurotransmitter disturbance and is not secondary to malignancies.